Good afternoon. I'm Reg Helwer, Minister of Central Services for Manitoba. I'm joining you virtually today, but I am pleased to introduce my colleague, Health and Seniors Care Minister Audrey Gordon, as well as Dr. Brent Roussin, Chief Provincial Public Health Officer. Last week, the federal government announced the launch of the Pan-Canadian Proof-of-Vaccination Credential, or PVC, which launched in a few provinces and territories across the country. Today, I'm pleased to announce that fully vaccinated Manitobans can now also apply for their PVC. The federal credential will be recognized across the country for traveling in other provinces and territories and when returning to Canada from other jurisdictions. So how does it work? First step is to be fully vaccinated. The national card uses a QR code, just like our immunization card does as well. So to make it simpler for Manitobans, you can do it all from one place through our online portal. If you already have your Manitoba immunization card, please log into your online account and follow the prompts to request your Pan-Canadian PVC. You can choose whether you receive this QR code as a PDF document by email, or you can save it to your device and then the code is created. Once you have the code, you can print it off to carry with you if needed, or you can keep it on your phone or your electronic device. If you are eligible but haven't requested your Manitoba immunization card yet, you go through the same process and the system will automatically generate both QR codes. Thank you to the teams who have been working on this initiative in Manitoba in collaboration with the federal government as well as other provinces and territories to make this available. As you know, our province was a leader in offering a safe and secure card showing proof of immunization. In fact, nearly 1 million of Manitoba's immunization cards have been created either digitally or in our printed cards. The Pan-Canadian PVC is an important next step. And while we are still in our fourth wave and our public health officials continue to recommend that we limit our travel, we know that a safe resumption of travel is important and necessary for many people. Using this credential, we will be able to safely visit our family and friends, conduct business, and enjoy all of what our country has to offer. The federal government has indicated that the Pan-Canadian PVC will be required for travel by the end of November. So you have time to get this on your phone or print it out. With that timeline in mind, we also have work already underway to update the Manitoba apps that you likely already have on your phone to include the Pan-Canadian PVC in November. That means you'll be able to toggle or switch between your Manitoba and Canada QR codes in the app on your mobile devices and choose which one you show to confirm your vaccination status. The Verifier app used by businesses and venues will also be updated in November so it can read the Pan-Canadian QR code. This means they won't have to change how they check immunization status, even as the federal credential becomes more widely used. Before I turn things over to Minister Gordon, there is another important item that I want to share for people who are now able to have both the Manitoba immunization card and the Pan-Canadian PVC. You will notice that the federal card includes much more information about you, your date of birth, date of immunization, and the types of vaccine you received. We're all pretty familiar with what Manitoba's immunization card shows when verified. Your name in either a green screen with a check mark or a red screen with an X. That's it. So while after today you may have both cards, we strongly recommend you keep using the Manitoba immunization card here in the province and elsewhere where it's accepted. It restricts the amount of information that you're disclosing. It provides the least amount of personal health information, which is always a best practice when considering the security of your own data. We'll continue to keep Manitobans updated with the new information as the Pan-Canadian PVC rolls out in the province, including when those apps have been updated. For more information, I'd invite Manitobans to visit manitoba.ca/vaccine and follow the link under immunization cards and records. This will take you to the portal where you can request your Manitoba immunization card, as well as the Pan-Canadian PVC. With that, thank you for your time. I'll turn things over to Minister Gordon. Thank you.
Good afternoon, and thank you for the introduction, Minister Helwer. It's a pleasure to be here today with Dr. Roussin to speak more about the Pan-Canadian Proof of Vaccination Certificate and what that means for Manitoba. This is an important next step for our province, building on the excellent work that has been done in creating the Manitoba Immunization Card. As you know, we've administered more than 2 million doses of COVID vaccine. And as of today, about 83% of eligible Manitobans are fully vaccinated. This makes them eligible for their immunization card and now the Pan-Canadian PVC. As Dr. Roussin and Dr. Reimer have told us in the past, strong immunization uptake throughout the province is our path out of the pandemic, allowing us to safely return to the people and spaces we enjoy. The immunization card and now the Pan-Canadian PVC will help us to resume those activities as safely as possible. But we're in the midst of the fourth wave and we have more work to do. If you have not yet been vaccinated, now is the time to do so. The COVID vaccine remains available at locations throughout the province, at vaccine clinics, pharmacies, medical clinics, and many other sites. We know that it's important to protect as many people as possible as soon as they're eligible to be vaccinated. For this reason, the province is actively planning for the approval of the vaccine for the 5 to 11-year-olds following Health Canada's approval. Last week, Dr. Roussin and I officially launched the seasonal flu vaccine campaign. Yet another way we can all help to protect ourselves and each other this winter. It's convenient and easy to do, and it can be given at the same time as your COVID vaccine if you need one. The seasonal flu vaccine is available at numerous locations across the province, and you can book online or by phone or walk in at many locations. The public health orders are yet another way we have been protecting ourselves the last 18 to 19 months. The current orders expire tomorrow morning, Tuesday, and today we're announcing their extension with a minor change. Manitoba must stay vigilant in our fight against COVID-19 and the fourth wave. Our case numbers, hospital admissions, and ICU numbers continue to fluctuate, but we need to remain steadfast in our approach with the current public health orders that we have in place. We know that vaccination works. Currently, the vast majority of hospitalizations and ICU admissions continue to be in people who are unvaccinated. To fully bring an end to the pandemic, we all need to do our part and get vaccinated. So with that, I'll turn things over to Dr. Roussin.
Thank you, Minister Gordon. Thank you, Mr. Helwer. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. As indicated, the current public health orders will be extended for another 3 weeks with the goal of maintaining Manitoba's positive response to the fourth wave of the COVID-19 pandemic. The municipalities of Cartier, Headingley, McDonald, Richot, the towns of Niverville and Richot, St. Francis Xavier and Taché are geographically located in the Southern Health Santé Sud health region. But considering their vaccine rates are more consistent with that as Winnipeg, as well as their proximity to Winnipeg, the new public health orders will see these select municipalities treated like Winnipeg and the rest of the province. So this impacts retail. So currently the permitted retail capacity is 50% in the Southern Health Santé Sud health region, and that will remain unchanged for that region with the exception of the municipalities just mentioned. So permitting retail capacity is 100% in Interlake, Eastern, Northern, Paramount Health, and Winnipeg Capital Region. And this will now include the municipalities of Cartier, Headingley, McDonald, Richat, which is Niverville, Richat, St. Francis, Xavier, and Taché. Again, these retail in all regions still require the use of masks indoors, still require the ability of patrons to distance, but they have no specific capacity limit in those other regions. So all other public health orders will remain unchanged. So the orders continue to allow fully vaccinated Manitobans to enjoy as much freedom and as few restrictions as possible, while unvaccinated individuals continue to be restricted in many activities, and this is to reduce transmission of the virus as well as to protect against some of the most serious outcomes of being infected with the virus. So this includes limiting private indoor gatherings for households to guests from one other household, when any unvaccinated person who is eligible to be vaccinated is present on the property. And so that includes any people living at that residence. Limiting private outdoor gatherings for households to 10 guests when any unvaccinated person who is eligible to be vaccinated is present at the property. And that again applies to even someone living at that property. Reducing indoor public gathering group sizes to 25 people or 25% capacity, whichever is lower, for gatherings that include unvaccinated people who are eligible to be vaccinated. And this includes weddings and funerals. Indoor group sizes for faith-based gatherings, 25 people or 33% capacity, whichever is greater for gatherings that include unvaccinated individuals. All outdoor public gathering sizes are at 50 individuals, and retail capacity remains at 50% capacity in Southern Health Santé Sud region, with the exception of the capital region communities. And again, treating those municipalities like Winnipeg makes sense due to the proximity to Winnipeg, the stronger vaccine rates. We included these municipalities in the capital region in wave 2 when we had Winnipeg in a red restricted level. We included these municipalities there, so it makes sense to include them once again in the Winnipeg definition. So we're continuing to follow many indicators such as vaccine rates, test positivity rates, of course, case counts, and then most importantly, that strain on our healthcare system. This will help determine our next steps as we move forward. So we still need Manitobans to continue to step up and get vaccinated. We know vaccine is our best defense against COVID-19. It's the best way to protect yourself and the people around you. We know that respiratory virus season is fast approaching, including influenza, and so like Minister Gordon mentioned, our flu season vaccine campaign is well underway. So we suggest to all eligible Manitobans, all Manitobans over 6 months of age, do get vaccinated against the flu as well as COVID-19. The Protect MB website provides information on locations for both COVID-19 and seasonal flu vaccine, and why it's good for you, your family, your community, and the healthcare system, and where you can obtain these shots. So these new orders will come into effect on Tuesday, October 26th. They will remain in place until November 16, and then reviewed again at that time. And the orders will keep the pandemic response system at restricted or orange, while schools remain at caution, yellow. So thank you, and happy to take some questions.
Dr. Roussin, we also have a relatively high infection rate in Northern Health. You or your or your colleague, Dr. Atwell, I can't recall, one of you or both of you had said that it's limited to a couple of communities up there, but why not tougher rules for Northern Health as well?
So we do have some tougher rules in some communities there that we've worked with leadership, and we're continuing to work with leadership in other communities right now to try to impose further restrictions or at least guidance to address that. So the overall Northern Health region, we're not seeing widespread net transmission. We're seeing isolated ones in certain communities. So we are working with communities.
And if you don't mind indulging me in listing off which of those communities have tougher rules, Norway House, Matthias Cologne Cree Nation, which others?
Those are the ones that are listed right now for that, and then for details on the communities and the responses, would refer you to FNIB or the community itself.
All right, if we're hearing no questions here, go.
Sorry.
Go ahead.
I just wanted to circle back to the new QR code. Can we go over the privacy concerns? What's in the federal code that isn't in the provincial code, and what's the concern with giving this code to people to hold in their phones?
So thank you for the question. As you know, the provincial QR code shows whether you are vaccinated or not. It gives you a green check mark with your name. That is the only information that is available through the provincial version. The federal one that we have enabled now has more information. It shows the type of vaccine you received. It shows the date that you received that vaccine, and it shows the lot number. So those are things that we protect as health information for Manitobans, but it is something I think that the federal government, working with international organizations, has decided that this is the path of information that they need to have available.
So then what's the guidance to make sure that you're protecting that information yourself if you're the one printing it off or keeping it as a file or a photo in your phone?
So that's why we're recommending for your local restaurants that you continue to use the Manitoba code that just shows if you're vaccinated or not. It doesn't disclose any other information. As if you have traveled, you're pretty used to using disclosing information to airlines and other agencies, and they're very good at protecting that information. So we think that there's a good level of security with that sector.
Minister Helwer, Manitoba is the only province not tracking the use of rapid tests. How can we strategize how best to use the tests if we're not tracking how they're being used?
Well, the rapid tests are used with an employer and staff, and that information on who is tested and how they're tested is all part of your personal health information with that employer. We depend on those employers to keep that information discreet and not release it to the general public. So we have distributed over 1.1 million rapid tests to public and private sector employers in Manitoba, and they are the ones that decide how and when to use that test.
Now, I'm not sure which of ministers want to take this one, but there's understandably going to be some public confusion about two different vax cards. You can see my face. If you could see my face right now, you'd see I'm smiling because it's understandable. What are you going to do to make sure that, what kind of outreach are you going to do with, I guess, the airport and I guess to a lesser extent via rail, to make sure that when people show up for traveling, they've got the right one in their pockets? Because I know there's, like, even among my colleagues just talking about this since the tech briefing, there is some confusion. So what extra outreach are you going to ensure that people put the right documents in their phones or in their pockets heading into that Christmas traveling season?
Well, I guess as a traveler, you are responsible to have the proper documentation. If you're traveling international, you require a passport. You require additional information now that you have to make sure that you have available for the proper authorities. And it is incumbent on an individual who's traveling to make sure that they have that information. I agree, Bartley, there could be confusion on which code you have. Even if you have two on your phone, you might pull up the one and have to flip to the other when you're at the site. And we know when you're standing in a line, there's lots of pressure to get through as quickly as possible. But traveling takes longer now, and we have to make sure that you have the right information with you, or that you can access it. Our code is pretty quick to add to your phone. If you're in line and you find you have the wrong one, it's pretty easy to go into the site and get the correct code.
Minister, you look like you were about to say. Looks like you were about to say something that when your colleague started speaking.
I was just going to add that as we download, individuals begin to download the other QR code, they'll be able to toggle back and forth quite easily between the two of them. So we were just looking at that upstairs, and it was actually quite easy to move between them.
All right, we can go to the phone.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Colin.
Good afternoon. Dr. Roussin, my first question is for you. With the certain communities in Southern Health facing fewer restrictions as a result of good progress, is this an approach that you're interested in taking more often going forward, rather?
So we're continually reviewing the orders, and we always are going to use the least restrictive means necessary to protect the health of Manitobans. So these capital region communities, we've treated them the same as Winnipeg, during the second wave when we had Winnipeg restricted, and so reviewing the data, the case numbers, the vaccine rates in them, it made sense now to treat them the same as Winnipeg and as the rest of the province. And as we move forward with this fourth wave, we'll continue to review things, and we're always going to try to find that least restrictive means to keep everyone safe.
Regarding the pan-vaccination credentials, I was wondering how it might work at, say, border crossings with the United States, given that in Westman there are people who like to travel by car into North Dakota.
I guess thanks for the question. That is something that the U.S. border guards will have to deal with. Currently, if you're traveling there, you may have a printout of your vaccination record. They don't currently scan our QR code for travel. This is something that the federal government will be working with the United States on in terms of how they're going to be able to scan it, or if they're going to be able to scan it.
From CJOB, Skylar.
Hi, Dr. Roussin. We've heard quite a few anecdotal stories of parents of children who are taking their kids into the hospital with other respiratory viruses. And I know I asked about, the name has escaped me right now, but a certain type of cough, barking cough. And I remember the ER doctor told them that it was, maybe they've seen about a dozen of those throughout the weekend. Can you talk about what we're seeing in hospitals when it comes to all respiratory viruses right now, not just COVID?
So I don't have, the specific numbers, but we are seeing circulation of RSV, of rhinovirus. We've had, reports of croup or parainfluenza virus, and so we've only seen, I believe, 2 reported cases of influenza thus far this year, but we are seeing a lot of non-COVID respiratory virus circulating, most of it mild illness, but there are reports of, admissions to hospital with other illnesses.
And can you talk a little bit about what that means for, self-isolation requirements? You start to come down with a cough. Maybe you think you have COVID, but you don't have, some of the fever-like symptoms. You just have that cough. What should those people be doing, especially when it comes to, if they're debating whether or not still going to work or school?
Yeah, so it does add a challenge to a lot of our COVID response. One is we want people to stay home when ill. That's a message that's been in the past. It's important now because even if you're spreading other respiratory illnesses, they're hard to distinguish between COVID and they make people sick as well. So, the other strain is on testing. When we have a lot of non-COVID circulating, then there's going to be a lot of demands on testing as well. So we're going to have to really be cautious this year. We have to do whatever we can to protect ourselves from those other respiratory viruses, and luckily some of the things that we do now do that. So focusing on that distancing, mask wearing, hand washing, flu shot. These are all things that are going to help the circulation of those other viruses. But no doubt, if we see a significant increase in any of those respiratory viruses, it's going to put an extra strain on our healthcare system as well as our COVID response.
From the Winnipeg Sun, James.
Yeah, good afternoon, Minister Helwer. I'm just wondering, when will the proof-of-vaccination program be deactivated and under what circumstances or conditions?
Well, it's an excellent question, and you tell me when the pandemic is done and when other international organizations and countries don't need proof of vaccination, and I'll be able to answer that question. I don't know that there is a date that we can set for that. Domestically, it'll be up to some of the provincial governments when we no longer need proof of vaccination, but internationally, the federal government will have to deal with that side.
I'm just wondering, when will children need, or will children need the federal PVC when and if they qualify for vaccination?
I suspect that that's a good question for the federal government. If you are traveling internationally, I think their view is that you will need proof of vaccination.
From the Canadian Press, Steve.
Oh, hi there. Mr. Helwer, is the province working on having a card that would have both the provincial QR code and the federal QR code so that people can have that convenience of having that wallet-sized card with them?
That is something we are indeed in discussions with the federal government about, Steve, and we don't have an answer from them yet whether they will enable the enhanced QR code to be printed alongside the Manitoba one.
And Dr. Roussin, we've seen today the release of case counts and other data for the last several days. Are we seeing another sort of uptick in this fourth wave? And is that tied perhaps to Thanksgiving?
Well, we're certainly in that area of time where we're going to start seeing the effects of Thanksgiving. We saw a day on the weekend there with nearly 150 reported cases, so that's higher than what we've typically seen. So we're going to have to continue to follow those trends. We're certainly not done with this fourth wave. We're still at risk of increasing case counts. We're still at risk of that equating to strain on the healthcare system. So it's why we're extending these orders, and we'll have to follow those trends.
From Global News, Brittany.
Hi, good afternoon. Dr. Roussin, I'm just wondering what advice you're going to have for businesses that are now going to be contending possibly with two different QR codes and how that's going to work for them.
So I do believe that we're going to have information out to businesses. The Manitoba, the reader that reads the codes of Manitoba is going to be able to read that code. So I wonder if perhaps Minister Helwer might have information on that. I think he's already addressed some of that.
Sure. Thanks, Dr. Roussin. Yes, the current reader, of course, that we have reads the Manitoba QR code that people are familiar with and that they've been using for several months, and businesses are used to that type of process. The new reader we're working on to enable reading the federal QR code, and we expect that that'll be completed by mid-November. And of course, the federal government has required this to be done by the end of November is when you'll need to be able to use the QR code.
Thank you. That's the only question I have.
We now return to the News Conference Theatre.
Dr. Roussin, just further along what Steve was asking about, the 7-day average is up to 101 today. In Manitoba, we were up at 112 on October 8th. We declined to 83 as of Thursday. Bit of a spike in cases in the last week here. So I know you're constantly looking at these models here, but are you expecting a little bit of up and down? Or is this, can you get a little bit more granular detail on the epidemiology? Is this more Southern Health? We see some Prairie Mountain Health case. Is this province-wide or granular or whatnot? Yeah, so I mean,
I think we still see a predominance of cases in Southern Health. We are certainly seeing those isolated outbreaks in Northern Health, which is driving up their test positivity as well. But we're seeing transmission in all regions right now. And then on top of that, a concerning feature, what we've been seeing a lot of in this fourth wave is that a significant proportion of people being admitted to hospital are only testing positive for COVID upon admission. So most people have been ill for 7 to 10 days before they require admission to hospital, and then now we're diagnosing them only upon admission. So we used to be able to rely on our test counts. If we have 100 test positives, we would expect a week from now about 7 being admitted to hospital, 1.5 to 2 to be admitted to ICU. That's kind of limiting our ability to do that now because many are being diagnosed quite late in their course.
And a question about something that the minister had said this morning, and that we heard from Scott this morning, and also the minister just now. Can you clear something up? Is it end of October versus end of November? There was some previous reporting that the feds are requiring proof of vaccination for the end of this month. So what's the difference between the end of this month's requirement and the end of November that you were speaking of? Which is it? Sorry, I don't need to be playing. The look in your face suggests I just stepped on your lunch or something.
Are you asking me that
Yes,
question?
yes.
Or is that a question for Dr. Roussin? So the direction we've received from the federal government is that they want the QR code available for the end of November.
So, okay. So you won't be required to be fully vaccinated till the end of November.
No, I'm not saying that at all. You're required to be fully vaccinated as soon as you can. I recommend you highly that you get vaccinated all across Canada. The proof of vaccination for international travel will be required for the end of November. And as I'm sure you know, the proof of vaccination is not just that you have received those vaccinations, but that you have received them 2 months prior to your travel. Or sorry, 2 weeks prior to your travel.
What about this period that we have where the scanners that Manitoba is providing don't read the Pan-Canadian code, and there's interprovincial people still coming to Manitoba? Are we sticking with the status quo on that for now, on how to verify people's vaccination status?
So my experience with Manitoba restaurants and restaurants out of Manitoba is that if you have a printed version of your vaccination record, they will accept that at the current point until the QR code for the international becomes available, and they may use that as a record. That's what the practice has been in restaurants in Manitoba and in other provinces.
It kind of seems like the Manitoba one might become redundant when the federal one can be scanned everywhere. Are we planning on keeping the Manitoba one at that point?
The Manitoba one has a limited amount of information, and I guess for people that are very interested in reducing the amount of information that they disclose to others, it is a preferential card for that reason. The international code or the federal code discloses much more information, and the people that usually disclose it to for travel, as we said with airlines and others, are very good at keeping that information confidential. So it's your choice on which code you use when. If you're comfortable with other people seeing your date of immunization and such information, then you're certainly welcome to use the federal QR code, but we do recommend to use the provincial one for your usual course of information when you're going to a restaurant or elsewhere.
Just a question for Minister Gordon. You cautioned earlier that we are still in a fourth wave, and given what Dr. Roussin just said about some of what we're seeing in hospitals, can you provide more details on what's being done now to make sure that there will still be room in hospital for people, whether they're getting COVID treatment or for these non-COVID procedures that still have to be ongoing?
Thank you for that question. So patient flow is a priority for our government and for the healthcare system. So ensuring that individuals are at the right place, the right time and for the right amount of time, so that individuals with more low acuity illness that can be treated outside of our acute care hospitals are transferred to the appropriate level of care. So that is very much a focus of the system right now, is to ensure patient flow is occurring so that we're moving individuals out of our acute care hospitals and making room in the event that we need the space in the ICU.
right, not hearing any more questions, so we'll call it a wrap, and thank you very much, folks.
Thank you.